People who have had liver disease, have it now, or know someone with liver disease know that it is a silent killer. Most people don't find out they have it until it's pretty far along, which makes it an even more dangerous condition. But have you ever thought about what your life might be like if you had kidney disease? Few people are educated enough to know that the signs and symptoms of kidney disease are not quiet, but they happen often enough that they can be ignored. In some cases, the symptoms might not even start to show up until the illness has reached a very serious stage. Because of this, it's even more important to know what the signs are and be able to spot them. Here are some of the top 12 signs of kidney disease that you should look out for. Extreme fatigue. Erythropoietin is a hormone that your kidneys make when they are healthy and doing their jobs right. This hormone helps the body make red blood cells, which are what carry oxygen throughout the body. When your kidneys aren't working right, the levels of this hormone will drop very quickly. Because the number of red blood cells drops so quickly, your body will become weak and tired. Having pain or trouble going to the bathroom. You might have trouble emptying your bladder, feel pressure, or even feel pain when you try. If you have this sign, it's possible that you suffer from an infection of the urinary tract. This is easy to treat, but you should get it checked out as soon as possible, because if you don't, it could spread to your kidneys. In addition to the pain in your neck, you might also get a fever. When blood is found in the urine. This is one of the signs that can't be ignored, and it's one of the main reasons to worry about the patient's health. So if you find this, you shouldn't just throw it away. Blood in the urine is a clear sign of a problem with the kidneys. If you have this sign, you must make an appointment with your primary care doctor as soon as possible. As soon as possible because there is a chance that blood in the urine is linked to many different kinds of bladder cancer. Changes in the way your urinary system works. The first sign that you might have kidney damage is a shift in how often you have to go to the bathroom. There is a chance that the amount of urine you pass will change drastically either way. At some points, you might also notice that the color of your urine has changed. You might also feel like you have to urinate all the time, but when you get to the bathroom, you can't. If you notice a change in how your bladder works, you should start paying attention and writing down how many times you go to the bathroom every day. This is important, especially if the change is big. Swelling or edema. Your kidneys are in charge of getting rid of all the waste and extra fluids in your body. Once they can't do that anymore, this extra waste and fluid will start to build up in your body. When this happens, the person will notice that their feet and ankles are getting bigger, their face is getting puffy, and their hands are getting stiffer. Foamy urine. You might think that a lot of these symptoms have to do with the bladder on their own, but because the bladder and the kidneys are so connected, the bladder is the first organ to be affected if the kidneys are failing. And foamy dark urine is one of the most important signs of the disorder that is related to the kidneys. Disorientation and a hard time keeping your mind on one thing. If your kidneys are making you tired, then the lack of oxygen in your body will also affect your brain. It's possible that this will make you feel dizzy and make it hard for you to focus. This is because when the brain doesn't get enough oxygen, it works less quickly. Having a lingering feeling of chill. If your anemia is caused by kidney disease, you may feel cold, even when you are in a room that is at a normal temperature. A kidney infection called pyelonephritis has been known to cause both fever and chills. Rash and itching of the skin are symptoms. Rash is a sign of kidney disease or failure, but it is often mistaken for something else, like allergies. Rash, on the other hand, can be a sign of kidney disease or failure. This condition is caused by kidney failure, which also causes waste products to build up in the blood. This is what causes the skin to itch so much and break out in rashes. When you breathe in ammonia. When a person's kidneys aren't working right, there is more urea in their blood. This breaks down the urea in the saliva into ammonia, which smells like urine and is a type of bad breath called ammonia breath. Illnesses that cause nausea and throwing up. If your kidneys are failing, you will feel sick to your stomach and want to throw up all the time. This is not going to happen just once. This is something that will most likely happen to you. This happens because the body needs to get rid of the waste that has built up, which is why the condition causes people to throw up. Feeling sick and short of breath. If the kidney disease is bad enough, it can cause fluid to build up in the lungs, which can make it feel like you can't breathe. In this case, your body won't get the oxygen it needs if you have anemia or a disease that affects the kidneys. It's important to remember that just because you have one of these symptoms, it doesn't mean you have kidney damage, even if you do. Even though many of these symptoms are also signs of other diseases and infections, it is still important to find out what is causing them and talk to your doctor about them if you have them. They can help keep your kidneys healthy and keep you alive. Let's talk about some of the ways you can protect your lungs. Don't smoke. Smoking destroys your body's blood vessels. Because of this, your kidneys get less blood, and so does the rest of your body. Also, smoking makes it more likely that you will get cancer in your kidneys. If you quit smoking, your risk will go down by a lot. But it will be a long time before the risk is the same as for someone who has never smoked. Make sure to drink lots of water. It's common advice that you should drink 8 glasses of water every day, but there's nothing magical about it. But making it a goal is a good idea because it will push you to drink enough water. The health of your kidneys will improve if you drink water regularly and consistently. Salt and other toxins can be flushed out of your kidneys by drinking water. Also, it makes it less likely that you will get chronic kidney disease. Try to drink 1.5 to 2 liters of water every day. How much water you need depends mostly on how healthy you are and how you live. When figuring out how much water you should drink a day, it is important to think about your age, gender, level of physical activity, general health, location, and whether or not you are pregnant or breastfeeding. People who have had kidney stones in the past should try to drink more water to lower their risk of getting more stone deposits. Check your blood pressure often. High blood pressure can cause damage to the kidneys. High blood pressure can be very bad for your body if it happens along with other health problems like diabetes, heart disease, or high cholesterol. Health experts say that a blood pressure level of 120/80 is healthy. A person is said to have prehypertension if their blood pressure is between 120/80 and 139/89. Right now, you might be able to lower your blood pressure by making changes to how you live and what you eat. If your blood pressure readings are consistently over 140/90, you might have high blood pressure. You should talk to your primary care doctor about the possibility of making changes to your lifestyle, possibly taking medicine, and regularly checking your blood pressure. Keep an eye on your blood sugar. If you have diabetes or any other condition that makes your blood sugar rise too high, you could hurt your kidneys. When your cells can't use the glucose or sugar in your blood, your kidneys have to work harder than usual to filter the blood. After a lot of work over many years, this can cause damage that could be fatal. But if you can keep your blood sugar under control, you will be less likely to have damage happen. Also, if the damage is found early, your doctor might be able to take steps to stop or limit any further damage. Thank you so much for watching this video. Please make sure to hit like and subscribe to this channel for more interesting information.